Hey guys, I'm going to be doing visceral diagnosis lecture for week 3. This week we finished up lymph nodes and we got into the thoracic region. So I'm going to start with what we finished with lymph nodes. There's a couple different things that you want to look at in terms of when you're looking at different lymph nodes. You want to look at the onset, when it came about, how long you've had it. You want to look at the site, where it's at. Is it in one generalized spot or can you find it all over the body? You want to check for tenderness, if it's painful, if it's not painful, it's going to mean different things. You also want to look at changes in size. If there's rapid growth, that's very suspicious and you want to take a closer look at it and keep an eye on it for how long it's taking to increase in size. So if we're looking at a suspicious lymph node, it's going to be hard, it's going to be fixated, and it's going to be painless. In terms of benign or inflammatory lymph nodes, they're going to be soft. They're also going to be painful, but they're going to be movable. So that's going to give you a clue as to whether it's inflammatory or not. You want to look at different people's symptoms. Sometimes symptoms can lead you to believe that something's going on with the lymph node. So if they ever have coughing, night fever, night sweats, if they have loss of weight or a lack of energy, or a history of contact with TB or a history of recent infection, you want to be looking at their lymph nodes, see if something's not draining right or if they're increasing in size. And that's about all we talked about. We talked about a couple different diseases with lymph nodes, but I'll let you guys look at those. And we got into thorax this week. For most of the lecture, it was pretty generalized, just reminding us of the anatomy in the thorax region. We spent a little bit of time talking about the heart, and when you have different hypertrophy of different parts of the heart, the easiest way to remember what might be causing hypertrophy of that particular area, whether it's the atria or the ventricle, is what valve is going right after that. So the blood is flowing through there to get to what valve. If you have stenosis of that valve, you will have hypertrophy of that area in the heart leading through the valve. So that's a pretty easy way to remember different causes. Just say whatever valve it is, stenosis, that's why you have hypertrophy. It's not the only one, but he spent a good deal of time talking about the different hypertrophies you'll have. He got into lungs. He talked about if you have an upper respiratory problem, that consists of the ear, nose, and throat, or the pharynx, larynx. If you have a lower respiratory problem, that's when you get into trachea, the bronchioles, the bronchi, and the alveoli. There's about 300 million alveoli per lung, and what keeps them open or expanded is the surfactant or just the atmospheric pressure inside of them. He mentioned asthma. It is not an infection, it's an allergic, I'm sorry, not asthma. Hold on. Yeah, it is asthma, just kidding. It's not an infection, it's an allergic reaction. Smoking is the most common thing that irritates the lungs, and whenever you're coughing, that's a cough reflex that we have to get rid of something that's irritating the throat. And he spent a lot of time talking about the individual lung and in the trachea leading to the lung, the protection that we have, the mucus layer. We want to hydrate it, that's kind of like our moat. It has the sharks with the laser beams. If we don't have enough water in there, we can't keep out the bad guys. So stay hydrated and make sure you go outside and get some fresh air, since we spend most of our day in recycled air. It's the best thing you can do, especially if you're trying to fight any kind of infection and with tuberculosis. That's all we got this week.